Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, I'm Dr. Michael Bookhart. Come join us at our newest clinic location at Good Faith Wellness Center. We provide compassionate health care for your entire family, from virtual visits to office appointments. We're committed to providing the best care. We accept all insurances, and we provide monthly wellness plans. Let's start your family journey to a healthier, happier life. Schedule your appointment today, and remember, true wealth begins with good health. Hello, I'm All right. Hello. Welcome to another episode of Telehealth Tuesday. I'm your host, Dr. Michael Bookhart, and this is going to be an amazing show, as it is every Tuesday. We just wanted to get on here and talk about some things that are going on, in the medical community. We talked about last week, we did talk about mental health, and especially in African American men, but also all people. And, a lot of times, we have some amazing guests for you every single week, but sometimes, some things get switched up. And so I guess you just got me all to yourself. We do take call in. So if anybody would like to come in and talk with us, we'd love to hear from you. So go ahead and put your comments in there, comments, questions, concerns, any feedback. We would love to hear from you. I've got my folks over here on our Instagram page. And let me know if you guys can hear me on Instagram in Instagram TV land. I want to let you guys know that we can be seen on our YouTube page, Dr. B TV. That's DOCTOR, the letter B, TV. Also on the page of Mike Bookhart and also Michael Bookhart, MD, MBA, and also Instagram as well. So please make sure to like, follow, share, subscribe, all those good things. So one of the topics we wanted to talk about, we'll get right to it. Let's talk about common topics in medicine. Let's talk about hypertension and diabetes, right? This is some age-old things, but wanted to bring that up again because it is something that truly plagues everyone around the world, but especially here in Mississippi. I'm sure that all of our listeners, if you unfortunately are not plagued with these unfortunate diseases, I'm sure somebody in your family definitely has it. And also, we want to pause for the cause and thank all of our sponsors, P5 Solutions, and also want to give a special shout out to Education Station for always being there and supporting the previous clinic, being there. So just wanted to give a special shout out to you as well. But thank you all for being great listeners. Thank you all for supporting us through these now 36 episodes. So let me know right now who's in the bill. You guys come on in. I can see some of the listeners, the viewers are coming in the room. I see the numbers going up. And so let us know what topics you want to talk about tonight. While we get started, I wanted to talk about, again, in addition to high blood pressure and diabetes, what is that? Like, people want to know, what is that? Well, high blood pressure. So, and it's something called, there with Katrina, what's going on? Good evening. Good to see you. People talk about, well, what is hypertension and high blood pressure? What is perfect blood pressure? Well, 120 over 80. That's systolic over diastolic. 120 over 80 is, that would say, the goal, perfect blood pressure. But anything under 140, the top number, is still considered, kind of in the normal. You can say pre-hypertension, but it's still not, it doesn't warrant you getting on medication. So again, this is the place where you can come in. It's free. We're not beholden to anybody. This is not about any insurance companies or anything like that. We're not politically affiliated. We're just here to share this as our medical ministry to the community to help you guys and give you all amazing information. Like I said, we usually have amazing speakers to join me, and we'll definitely be bringing you some more as we normally do. But again, tonight, you got me all to yourself. So again, let's talk about burnout, right? I wanted to let you all know, so in the medical community, the prevalence of burnout amongst healthcare professionals. So there was a journal article in NPJ, Mental Health Research. It says the healthcare work environment is characterized by strenuous activities, which can predispose healthcare professionals to burnout, and it can negatively affect their work performance. This is made worse by a heavy workload, which is a major problem for many healthcare systems with significant adverse effects on efficiency and patient safety. Also, and all the staffing shortfalls, when we talk about staffing, we're saying like the nurse to patient ratio. So once, for example, in the hospital on, say, a med surg or a telemetry floor, one nurse in the state of Mississippi should not be taking care of more than 6 people. But unfortunately, during COVID and different things and shortages, sometimes those numbers go up to 7 and even 8, and probably even worse, in other states and other countries. So, but these staffing shortfalls expose health professionals to overwhelming workloads, which increase the risks of stress, illness, and absenteeism. The resulting physical and mental exhaustion can affect the worker's clinical decision-making, the quality of communication with patients and colleagues, as well as the ability to cope with work-related pressure. While burnout among health professionals and its impact on healthcare systems has been studied historically, it's not extensively documented in the African context, where work in healthcare settings is often characterized by understaffing, resource limitations, and excessive workload, which are known risk factors for work-related stress. So, with all that said, that's why, when people talk about the real heroes, there truly are some medical heroes. And not just because I'm a family medicine doctor, but especially during COVID, you remember how trying those times were. And it was very, very difficult on us. And sometimes you didn't know whether you were coming or going. And then they had the ice storm here a few years ago that some of you guys remember. So a lot of healthcare workers were there sleeping at the hospital, just to be there to take care of you and your loved ones. So that's why these are the true unsung, unspoken heroes. But anyway, I see we've got some more people. Good evening. Welcome to Telehealth Tuesday. So we'd love to hear from you. Like I said, go ahead and everybody you can send us your questions on the comment box. Hello again to all of our viewers on Instagram land. We would love to hear from you, love to see you. Let's go back. So, and you guys can also let me know any questions or any topics you want to cover. This is a totally open forum. This is an open forum. So, all right, Octavia, what's going on? Good evening. Thank you for watching Telehealth Tuesday. Welcome to all of you. So we got some people here, a couple of healthcare professionals I see that are looking. And y'all feel free to chime in, talk about if there's anything that has plagued you or anything that you feel happy about or anything that you just want to discuss or let the viewers know from your standpoint. Please make sure to comment. But yeah, the staffing shortage, that was a huge thing. This just kind of gives some of you guys some insight into what it was like during COVID and some of these tough moments, So, and I think that, with it separating people from their families and doing so much, that was so hard on all of us. And so, I think that anytime you see your fellow healthcare workers and people just, give them a pat on the back, give them a warm hug, because that goes a long way. So let's go back to hypertension, diabetes, right? We talked a little bit about high blood pressure, hypertension. A lot of people say, well, what kind of things can I eat? And, when I came to Mississippi, folks would say, well, I eat pork. Or I say, well, one of the first things we will take you off of is pork. And they said, I don't eat pork. I said, well, what'd you have for breakfast? And they said, I had bacon and eggs or sausage and grits, And a lot of people don't know that. They don't understand that, that is one of the worst things for you. Now, of course, some other folks might argue and say, well, what about that beef? What about red meat? And it's a similar thing for that too. All things are in moderation, and the Bible talks about that. The Bible talks about, eat it. So, for example, you can think about even drinking water. There's a such thing as water poisoning. There's even a such thing as oxygen poisoning. So you would think that, if somebody has something like that, that is so good for us, water. But you think about it in somebody who has like congestive heart failure or a person who's on dialysis, those people who have to go 3 times a week to the dialysis center to get fluid off, to get their body basically cleansed, because their kidneys can't do it. That's something that, so too much water, too much fluid in these patients and these people would be very harmful, and they would basically drown in their own fluids. And so that's how you have to, again, well, the Bible calls it temperance, but we in healthcare say we in moderation. And so that's what, let's see, I finally made it. All right, good to see you. I'm fine, glad you made it too. So yeah, that's why we have to be so mindful. But, and another thing is, let's say when our diabetic patients, a lot of times they think about diabetes and sugar, and they say, well, I'm not eating desserts. And I want to let you guys know, when we talk about carbohydrates, man, that's, basically anything white, white potatoes, white rice, bread, the bread, the white bread on the pizza, on the crust of the pizza, all of those things, those delicious foods that we love in a diabetic patient is no good, no bueno. So our first question of the evening from my lovely mother: why do so many Black people have hypertension? Well, and that's a great question. The reason, it's a lot of factors to that, okay? We see a lot more African Americans in the southern states like this, right? Some of that has to do with genetics. You can say, well, most people, or both of my parents had high blood pressure. Um, and then another thing is a huge determining factor is the diet. A lot of times, like I talked about the pork, and people saying, well, wait a minute, I don't eat pork, but they eat, loading up with 8 pieces of bacon. There's one of the grocery stores here, I won't say the name, that has a wonderful breakfast every day, Monday through Friday. And they've got the big mounds of bacon, and people come in there and they even serve fried chicken for breakfast. So, thinking about all those kind of things, man. So those are some reasons. So basically, heritage, family history, also, where you live, sometimes even denominations and church, like certain Seventh-day Adventists and other religions, Muslim, that don't consume pork. A lot of times, especially Seventh-day Adventists, which is what I was raised as, we don't, even though sometimes I know we slip a little bit, but in our faith and denomination, Seventh-day Adventists, I believe the average was that they live for about 8 or 9 years longer than the average person. But don't quote me on that. But just so that you have to factor that in, and religion is huge in the South. And so, and then also a person's stress level, people that are, really struggling in life. Maybe you've got a bad marriage, bad kids, bad, whatever it is. So there's a lot of factors with that. And another huge one is non-compliance, meaning people that even though they know what disease processes they have, diabetes, hypertension, whatever, they don't do right. They don't take their medication. They don't follow up with the doctor. They just don't do right. So, so that's that's a great generalized question, a loaded one. So hopefully, Mom, we answered your question. Let's see, right, and diet drinks. Yeah. So absolutely. And I'm glad you brought that up. So a lot of diabetics will say, well, Dr. Bookhart, man, I had a Diet Coke, like, you hear all the comedians talking about that, and they say, well, I had a big, huge sandwich, like a huge Whopper or a Big Mac or whatever, double fries, a huge fry, and a Diet Coke. And, that's definitely something that there's no such thing as a healthy soda. So it's always funny to hear people justify when they're doing that, that there's, I'm doing a Diet Coke or a Diet whatever, or a Coke Zero. There's no way to make a soda healthy. So I tell them, you really might as well go ahead and drink the regular soda if you must. So those are just some things to keep in mind. And I really appreciate that. Y'all keep them coming. Keep the questions and comments coming. We want to definitely hear from y'all. I'm having to switch over back to Instagram. Can y'all hear me out? I'm going to try something there. I'm going to try that on Instagram. It's 2 separate. So I'm going back and forth here. Let's see. Okay. 1 second, guys. Okay. All right. So yeah, come on in and ask your questions if you guys want to join in, and if you want to come on camera, there's a way. I found out last week how to do that, how to send the link so that you can join in. So we'd love to hear from you. We got a couple of questions people are sending me. Let's see, a couple of questions there. Okay. What's going on, Dr. Snell? Good to see you. I know Dr. Snell's got something good for us, so come on in with a word. She is the one of the famous and illustrious dentists here in Jackson, Mississippi. So it's so good to see you, always supporting. So y'all come on in. I see a few more people are coming in. So look, tonight I want to pause for the cause. This is Telehealth Tuesday, where we are here every Tuesday, God willing, at 7 p.m. Central Standard Time, from 7 to 8 p.m. And we are here to answer your questions, comments, concerns. Again, we normally have other guests here. We've had everyone from We've had an elected official, we've had comedians, we've had law personnel, law enforcement, doctors, nurses, therapists, psychologists. So you never know. We've had Dr. Snell on there again, one of our local amazing dentists from here from Jackson, Mississippi. So y'all come on in. But we were touching on burnout in the healthcare community, what that is. Just wanted to give you all a little insight into how it was when we were going through COVID and things like that. And it was truly uncharted territory. Um, okay, let's see. We've got a question from the good Dr. Snell here. Let's see. My sinuses are killing me. Physician question this time. Okay. Uh, Green versus yellow versus clear. Does it matter? And that's an excellent question. So basically, you're asking about, either sometimes forms of sinusitis. Could it be sinusitis versus seasonal allergies and hay fever? Could it be some other form of upper respiratory infection or bronchitis? And the thing is, again, that's a very great question. The color of somebody's mucus, hopefully that's, not grossing you out too bad. But when it's more like discolored, brownish or closer to green, we would think upon looking at it like a grayish, that this person does have something going on. More greenish, we're thinking more of an infection, bacterial infection. There's also viral types of upper respiratory infection, rhinitis. Viral, a lot of times it's not as bad as the bacterial, and so maybe a person's sputum is not going to be as discolored. Sometimes it may just be white. Sometimes you get a chronic, like a smoker's cough or chronic bronchitis. A lot of times it's kind of a whitish or a frothy kind of sputum. So definitely the color matters. But if it's clear, a lot of times that's usually 90% of the time not infected. And it just could be from somebody's allergies, something draining, or other things, or it could be a viral issue, which is really the most common. When people are having bacterial sinusitis, you got tenderness, you're pressing here, you're like, man, my head is killing me, I'm pressing here, it's tender. So just kind of different things going on there. So I hope that helps and answers your question, Dr. Snell. Let's see here. Okay, they're saying, let me check on that. Is this limiting who can ask questions? Shouldn't be doing that. 1 second. Let me I don't know why that's going on because okay. I'm seeing I didn't see questions. Okay. My friend has some questions, want to ask about her husband, so I have some. Let's see. It should be letting you guys. Let's see. It should be letting everyone in. We didn't limit the comments, so I don't know. I don't know why that's going on. Can you guys post some comments in there? Somebody. Okay, there's Dr. Snell, because we're getting some comments in there, but okay, we got some folks on Instagram that have joined. Yeah, I don't know. Let me take a quick look at one of the social comments. Show previous. No, we don't. We don't have any limitations on that. No, so I don't know. I'm not sure. Are they logging in from Facebook or YouTube? You guys let me know. Okay. Okay. Let me know if you guys can hear me or can comment out there, because we'll have to definitely take a look at that. But it should be. And she said it answered the question definitely better than Google. Okay. All right, well, I guess we're doing okay, Dr. Snell. I guess we're doing okay because Google is like, that's the gold standard these days. So I guess we're doing all right. Let's see here. The question. limited who can. I don't know why that. Okay. I don't know why somebody sent me social. Sorry about that, guys. I don't know if that's when we're streaming to Instagram now. That's the only change that we've made. So I'm not sure. On Facebook, strange. On Facebook, some can't. Okay. Yeah, that's very strange. I see people. Facebook name. Okay. I see some folks. More folks are joining. So welcome. You guys come on in and ask your questions. We're here taking open questions. There's no subject that's off limits. Let's see here. Okay. Okay. Here we go. Okay. So what's that question? Go ahead and let's say you can go ahead and send it to me there. Or you guys go ahead and type it there. The question if somebody had about her husband, I believe, you can go ahead and ask us. But yeah, in the meantime, let's go back to that. So yeah, we were talking about, I think we were talking about the sodas and diabetics, and a lot of times they'll have different. A lot of times they'll say, well, I'm doing this, so that'll justify this, and so that's always funny to us in the healthcare field. But again, and sometimes going back to my mother's question, why so many people have that, some people just don't know any better, and in the healthcare field, a lot of times in a really busy office or in the hospital, a lot of times the people are running late or running behind. The doctors are just inundated with patients. And so rather than either argue with a patient or rather than go back and forth, they'll just refill whatever prescription, or they'll just go ahead and not counsel you appropriately because you just don't have the time. And unfortunately, again, that leads back to what we were discussing earlier about burnout. And unfortunately, it's unfair to the patients because then the patients don't get the best care that they need, So okay. They wanted to know, what are the symptoms of a stroke? Well, let's see. Now, the classic symptoms, people always talk about, the drooping of the face, the slurring of the speech. Sometimes you might, you can't lift up your arm. Sometimes you're dragging your foot. Those are the big symptoms. But sometimes it might be a TIA, which is a mini stroke, or a transient ischemic attack, which is not, you can say not a full-blown stroke, but a TIA is like a precursor to a full-blown stroke, right? And so a TIA can have some deficits like that. Like you might say, man, my memory got real crazy, real foggy for a moment. And then a few hours later, I snapped out of it. Or my face was drooping a little bit. And some people might say, well, maybe that was just Bell's palsy or something like that. But next thing you know, the symptoms rapidly resolve. So that's like TIA, transient ischemic attack. Could be a precursor to stroke. But then again, if you control blood pressure and control a person's blood sugar, blood glucose, then hopefully they'll be okay. So those patients, if they get admitted to the hospital for 23-hour observation, you observe them on a telemetry or a neuro unit, and you do every 2 to 3 hours, you'll do neurological checks, looking at their pupils, testing their grip strength, their sensation, making sure that nothing has changed. And if you see any changes in that period, then they'll alert whatever doctor's on call. And then there's protocols like code gray and all that kind of stuff. But anyway, but basically the symptoms, so that the symptoms can really vary. And then somebody who's having a massive stroke or a large stroke, you may see some true big time, like obvious deficits, where you're like, man, your face is completely twisted, or your mouth, or did you notice like what you're doing? Did you notice you're kind of leaning towards one side? Or when you walk, I noticed that you're like almost about to trip over. So things like that. Let's see. Uh, the symptom. Okay. So they're saying that they saw their husband fading out a few times, and I didn't know if he was falling asleep or what. He was just diagnosed with diabetes and high blood pressure, and his A1C is through the roof. So let me tell you what that, the hemoglobin A1C, right? That is the marker of how well somebody's blood glucose has been controlled for 3 months, right? And so you diagnose diabetes, hemoglobin A1C of 6.5 or higher. So if somebody says through the roof, I mean, probably I'm imagining somewhere around 10, 11. I've seen it as high as up to around 16, which is terrible. So, like I said, once you hit 6.5, that's actual diabetes. If it's below that, between 5.7 and 6.4, pre-diabetes, right? And a lot of times I've said that to patients and they'll say, well, I'm not subscribing to that. I don't have no diabetes. And I say, well, it's technically pre-diabetes, but that's still, you don't need the medication for that. You can just, diet and exercise, doing the right thing, getting some more rest, drinking plenty of water. Now, talking about the water though, that's one of the things. So excessive thirst and excessive urination, those are symptoms of diabetes. And I had a good friend of mine that, pretty fairly well-known guy here. And he came in and said, man, I'm drinking. And he came into my office last year and I was talking to him and I said, man, it really sounds like you might have diabetes. He said, it's really rampant in my family. It's very strong in my family. So lo and behold, his A1C, I think, was around 9 or 10, something like that. Yeah. And I said, man, bingo, that's exactly what it is. We got him on the appropriate medication. His A1C started trending down. He was feeling better, and got a hold of that. He had lost a lot of weight. I think he had lost probably 40 pounds or so. So, but yeah. So those are some of the symptoms of diabetes, and like I said, a lot of those things go along with the stroke question. This woman's husband, who was diagnosed with diabetes and high blood pressure. And if he was having this where you said he was fading out a few times. Now, again, fading out, getting dizzy, getting kind of sleepy, there's a lot of things that you have to keep in mind when you're talking about that, like keeping a broad differential diagnosis is what we say in medicine. And when you're going through training, what can make a person do that? Well, could they be drunk? Could they be tired? Is it a person working the night shift and they're just barely holding it together? Or is it truly a person with uncontrolled diabetes, uncontrolled blood pressure and all this? And, now they could be having a TIA or an actual stroke. So yeah, those are just some things to look out for. And the main thing is this: if you think somebody's having a stroke, most of the time, if they're still coherent enough to be like, hey, don't call 911. If you are really concerned, it is definitely better to do that because you've got a 3-hour window from the time that the symptoms started until the time that they can get some type of medical intervention, some type of procedure, or getting something called TPA, which is a clot busting drug. TPA has a lot of side effects and only given in the hospital. But sometimes that can truly save somebody's life, and it can actually reverse the symptoms that they're having. So if somebody's having profound weakness and slurred speech, and they identify with all the different scans, we can do MRI, CT, angiogram, all those kind of things. They identify a blood vessel that's blocked up or whatnot. You can go in there and either kind of root or some things, if you want to say, or you can go in there and give. You can actually give the clot busting medication in that area, that blood vessel that supplies blood to the brain, and you can see symptoms like magically resolve. So those are some of the advantages of just recognizing things early and acting on it. So you definitely don't want to delay. All right, let's see. The next question: what do you say to people that want to be put on medicine instead of trying alternative methods first? Now, that's a great question. That's a very interesting question. Um, and we do have that. I'll just say that it really depends on it depends on um, kind of how far along or how far gone, if you will, the person. So, for example, somebody who's got a newly diagnosed diabetic patient, if their A1C is 10, 11, that person definitely is past only being on pills. They're definitely going to be put on insulin, which is the shots, right? If somebody has prediabetes, which we talked about, which is A1C between 5.7 and 6.4, well, that person, definitely I'm not going to put them on metformin or Januvia. We're going to go ahead and stress the importance of diet and lifestyle changes, modification, which is walking 3 to 4 days a week, 30 minutes a day. Being careful, watching what you're eating, looking at the American Diabetes Association, excuse me, the recommended diet, the diabetic diet, limiting your calories to 2,000 calories a day, all those types of things, so those are some types of things you want to do. And so, put on medicine and yeah. And the alternative methods, unfortunately in med school, we don't get taught holistic medicine. Those are things that we pick up just kind of anecdotally or, on our own or from experience. And so there's certain, natural things you maybe want to go to the local vitamin store or GNC, and those people that work there are great at, giving you some advice, or you can see a holistic physician, or you can go to an herbalist, as they say, all kind of different things. And so, those are some alternative or naturopathic methods, if you will, in addition to, again, us losing weight and changing up our diet big time and trying to follow the American Diabetes Association. You got an 1,800 calorie, you got a 2,000 calorie, and you got a 2,200 calorie. They may even have some other ones by now. So that's what I would say to the, I think that it just depends, how bad it is, how severe. Some of those people would need medicine. And if it's somewhere kind of mild to moderate, then, somewhere in the middle, we can have a conversation and see how the patient feels. Because, ultimately, you don't want this to be a dictatorship, like some other countries out there. You want it to be, hey, I'm the medical professional, and although you're the patient, I'm not here to just tell you, let's come together. This is what I recommend. How do you feel about it? And do you feel like you could do that? And so that's what we recommend there. So, but that's a great question. So you guys keep them coming. We love questions, comments, and all concerns. Hopefully, let me see. I got some other things coming in here. They want to see through what'll happen. Oh, that was a cigar. What will happen if he doesn't stop smoking cigarettes? Well, all right, no problem. You're quite welcome. If he doesn't stop smoking cigarettes and he's already having this where you said he was fading out and he's got high blood pressure and diabetes, if all this is going on and you're smoking, man, that's like, I hate to say almost somewhat of a death sentence, but and the issue is that cigarettes, while they differentiate themselves from marijuana, cigars, hookah, and all that. Well, some people, I guess, they may inhale hookah, but cigarettes, you're actually inhaling that. So all the tar, the people smoke those types of things, cigars, hookah, cigarettes, because of the nicotine is one of the most addictive substances out there. And, you can get that a variety of ways, but with cigarettes, you're actually inhaling it, just like with marijuana. Folks are inhaling it. So it doesn't matter. It doesn't matter how you try to say, well, marijuana's from the earth. And this is certainly not a dig or anything against marijuana, because I think it's got healing properties, and it's it's a fantastic plant, and it is natural. And if it's used correctly, it can really do a lot of good. But a lot of people do abuse that. But yeah, basically anything that you're inhaling through the lungs is going to be bad. And so that's going to be one of the biggest risk factors that, this gentleman needs to stop immediately because he's already got all these other risk factors. He might have been having a TIA, a mini stroke, the other night when you said he was fading out. And if he continues to smoke cigarettes, that's going to cause what we call microvascular disease. In other words, those small blood vessels, arterioles, the things that, throughout your body, the heart pumps the blood and then it goes, supplies all throughout our body. And so those small things, capillary, all those tiny little blood vessels, diabetes causes issues with circulation, microvascular complications, as we say. And so people with that are diabetic, their feet sometimes look all dusky and, they lose the sensation and all that. That's because they've already got this small vessel disease, right? Problems with their circulation. And so doing it with cigarettes causes vasoconstriction like that. So it causes them to squeeze and clamp down even more. So you can imagine water going through a water hose. And if you're clamping down, it's not going to be able to pass through. So, that's exactly what happens when the blood's trying to get down all the way down to our feet. If you've already got blood vessel issues or blood vessel disease or heart disease, when we say disease, it's like you've got a lot of fat and plaque buildup inside the blood vessels that could be very narrowed. And it's that same kind of process that causes heart attacks because that part of the heart doesn't get nourished, Same thing in the brain. Those arteries that supply blood, carotid arteries coming up, supplying blood to the brain. If you got a blockage or a lot of disease in there from diabetes, especially smoking, that causes a lot of buildup plaque, just like the plaque on a person's teeth. Dr. Snell knows about that. You can imagine that stuff building up inside your blood vessel, and your blood can't get to where it needs to, and boom, TIA or stroke, or boom, there goes a heart attack. So let's see, my mother said blood pressure machines are inexpensive. Do you recommend that every family purchases a blood pressure machine for their home? Now, that is a very interesting question. What I can say is I don't think it would hurt, like you said, they are fairly inexpensive. You can go to local grocery store and Walmart, Kroger, and all that, Target. Probably get one for, $15, $12, $15. And then, they go all the way up, to the really nice Cadillac version of them. But just a basic one on the wrist. I mean, really, the wrist is not the best. You do want a cup that can go around the circumference of your arm. But yeah, just doing that and monitoring things, those might be $20, but $20 is a whole lot less than, paying a hospital bill or having a stroke or death. So, because a lot of people, hypertension or high blood pressure is labeled as the silent killer. And that's because like the gentleman we discussed fading out and all of that. That may because his blood pressure has been so high for so long. Then he got diagnosed with diabetes. He's smoking. So he's finally getting symptoms, but now it might be a little late. Now he might be actually having damage, to his brain from that. So, but when it's just early on, there's no warning sign. Like if you're not going to the doctor or not checking it at home, you would never know. So let's see. They said that I checked his blood pressure last night and it was 181 over 116. The night before it was 179 over 111. So that would be hypertensive urgency. But anytime somebody has symptoms or things that we can see like that, then it's hypertensive emergency. So when it's this high and he's having symptoms, only God knows what could be going on with this gentleman. And he needs to get to his doctor or the emergency room as soon as possible. You can't just be walking around with pressure that high, But going back to your question, Mom, so I would think that especially people, when you get to be a certain age, it certainly would not help. Wouldn't hurt to have a blood pressure machine, and they are inexpensive. So I think that's an insightful, it's a great question. It certainly wouldn't hurt. So I would say that. What are the signs? Let's see. What are the signs of heart attack versus anxiety? Man, that's a great one. So that's another one that'll be on the differential diagnosis, meaning that, let's see. That'll be okay. Then we put that back up. So that's another question that's on our differential diagnosis, meaning um, could it be this? These are things that look alike, that look and sound alike. So if a person comes in with crushing chest pain, let's say, oh my gosh, I'm short of breath. I was even sweating. It feels like an elephant sitting on my chest, pain moving and radiating down the left arm or the jaw. That is a heart attack, like nobody's business. Now, could anxiety exhibit some of those same symptoms? Yes. Now, normally you wouldn't have all the radiation of pain down the arm, the left side of the face, the jaw, but you could definitely have the shortness of breath, palpitations, which is the feeling of like a pounding heartbeat. That's palpitations, shortness of breath, sometimes even, sweating. And so they would look and feel like a heart attack. And the problem is that women have these, a lot of times their symptoms are masked in women. And a lot of times they are having anxiety. They think they're having anxiety attacks, or they think maybe it's just bad acid reflux from a bad diet or eating too much Louisiana hot sauce, Tabasco sauce, and all of that, and eating a bad diet, when it's really a heart attack. And women are at the highest risk for that, of having misdiagnosis or not being able to realize in a timely fashion that it's a heart attack. The reason why that's higher in women than men is because men usually have the classic signs. By the time a man has that, he's pretty far gone and he needs to be in the hospital right now. And he's having crushing chest pain, elephant sitting on my chest, I can't breathe, sweating, nausea, vomiting. He was having like several of those symptoms, if not all of them. So that would be the difference between that. Let's see, I have to be educated on what to report. I hear a lot of people say that they have a blood pressure machine at home, but they don't report it. And same with blood sugar. Okay, so you're saying you feel like people need to be educated. So you're saying even if they have the machines and the tools right there in front of them, you're saying that they need to know what is concerning or what is worrisome enough to report to your doctor. I think that's what you're saying. Okay. A lot of times that is a true thing with education. Maybe some people don't know. And the other thing is some people don't want to know, right? That's, again, and going back to, I think that was my mother who had the question of, why is it so much so many issues with heart disease or hypertension and diabetes in the African-American community. And like I said, especially in the South, these southern states and everything, Alabama and Mississippi, Louisiana, all that kind of stuff, Georgia. Because a lot of times, even if they have those tools, you could take your blood pressure right now, just like this unfortunate gentleman, the person's husband, and saying that his blood pressure is 180s over 111 and 112. Well, they've got the numbers right there. They've got the actual numbers, but I guess maybe nothing is being done about it. Maybe it's not being reported, or he's certainly not going to the doctor. And for what reason, I don't know. A lot of times people don't want to get bad news, they say, especially when it comes to things like cancer and all of that. But, like I tell anybody else, it would be a whole lot better to get some, unfortunate or negative news or something, even if it makes you tear up or cry right there in the hospital or in the doctor's office. But if you say it's breast cancer, colon cancer, diabetes, hypertension, whatever you're being unfortunately diagnosed with, every one of those things has some type of treatment, until it's too late. So catching this early, going and having your annual wellness exam, annual wellness visit, that especially for the people that are insured, your insurance pays for. And why do they pay for it? Well, a lot of times they want to keep you out of the hospital. And it's cheaper to take care of you and pay for some medication rather than you being laid up in the hospital. So, I think that's to answer your question, you do want to be educated on that, knowing what to report. But like I said, in that gentleman's case, having symptoms, feel like he's again fading out, as they said, and you've got your blood pressure is through the roof, and you got diagnosed with diabetes, and you're smoking cigarettes, that is literally a ticket to the grave. I do a talk. Some people who know about it or who've seen it, I do a talk, and it's entitled "An Annual Exam or a Ticket to the Grave. The choice is yours." So that's the name of it. And people sometimes they laugh, and it's I like to get a shock factor when I talk to audiences, because it's like, wait a minute, what did he just say? And I said, yeah, I said an annual physical exam or a ticket to the grave. The choice is yours. And that's because, by just getting your annual physical exam, you can find out whether you have high blood pressure, whether you have diabetes, and especially if you're 45, 50 and above, depending on where you lie in that age range, if it's time for a colonoscopy, if it's time for a mammogram, if it's pap smear, whatever it is, we can have early detection. And like I said, with most of these things, the majority, sometimes they require surgery, sometimes they require medication, sometimes they require, radiation. So so it just depends. But it's, just like a lot of us, no offense, Dr. Snell, don't like to go to the dentist. I know I don't, because I'm always thinking you guys are getting some pleasure with the little drills and numbing us up and having your patient drooling and all that kind of stuff. So it's, some kind of, sick enjoyment, I guess. I don't know. But for you guys, I'm just joking. But a lot of people are scared to go to the healthcare provider. They don't want bad news, and we understand that. And it's an art to delivering, news. But so let's see. Shamika, what's going on? Good evening. Shamika Thomas says, anxiety is mental, but it gives you physical side effect. Right. So that's exactly, that's a great point. That's exactly what I'm saying there. With anxiety, you have to be really careful. And that's why it's a really fine line with that, saying, well, do I report this to the doctor, or do I go to the emergency room, or what do I, because there's a fine line there. And a lot of times, if it's real to that person, we as the provider need to take that seriously, because if it's real to you, then it just might be real. So yeah, anxiety and real chest pain and different things like that, they can be very, very similar. They can be very similar. Let's see. What are the benefits of drinking red wine for women? Well, that's another one where a lot of people try to, say, well, doctor said a glass or two of red wine a day is not harmful. The truth of the matter is it's not necessarily harmful. But if your real reason for drinking red wine is to say, I'm getting the benefits of that, you get the same benefits if you're drinking straight up grape juice. And so I want to go ahead and dispel those rumors out there. Let's see. One second, we get something. Okay. Sorry about that. Okay. Making sure we don't have any other. So yeah, I'm sorry. You would get the same benefit. A lot of people they like to justify and say, oh, well, I'm, the wine. But the truth of the matter is, if you're worried about that, you can just drink some Welch's grape juice. Or, not that I'm putting a brand out there. It can be Ocean Spray. It can be whatever. It can be non-name brand. Okay. It could just be grape juice. And if it's 100% grape juice, no added sugar and all that, we're talking about organic, then we're talking about the same benefits. Thing is, with the wine, of course, it's a little bit more fashionable, and of course you get a little buzz with it because it's been fermented, and grape juice is just grape juice. And so, hey, what would be more fun to drink? Of course, the wine, but you get the same benefits in that. So, but yeah, a glass of wine a day is not harmful. Let's see. Speaking of early detection. Hypertension or high blood sugars can be triggers. Speaking of early detection, hypertension or high blood sugars can be triggers for something else. So I agree with the importance of wellness. Oh yeah, absolutely, yeah, and I appreciate you seconding that properly. Yeah, they can be definitely triggers for something else. And that's why, yeah, speak early detection. That's why you definitely want to go to your primary care doctor. You definitely want to do that. And absolutely. And nothing is when it comes to your health, nothing is more important than doing that. And because that's all we have, and it's such a blessing for people who are healthy and have healthy children and healthy parents and things like that. That is such a blessing. It's such a wonderful gift. And there are a lot of people out there that are born, less fortunate and that are born with conditions that they've never been healthy since birth. And so if you are somebody out there who has your faculties intact and all your wits about you and all that good stuff, man, that is such a blessing. So yeah, early detection. Again, my topic is normally an annual physical exam or a ticket to the grave. The choice is yours. So, Ebony, what's going on? Good evening, Ebony Taylor, who is also a registered nurse and a realtor. How do you feel about ashwagandha? That's a great question. Honestly, I tried that myself a few times. Somebody told me about that only a few months ago, I think, or maybe late last year. I think ashwagandha is wonderful. It seems to be something calming. Ashwagandha, for those of you who don't know, is natural. It's sold over the counter, or you can go to, again, GNC. That's not a plug for them, but you can go to Kroger, Target, wherever, in the natural, in the vitamin aisle. It's just like, say, melatonin, natural things that can help you provide calming. Melatonin is produced by the pineal gland in our brain, which is an actual hormone that we produce. And so by taking melatonin, that is something that every one of us produces, some more than others. But yeah, ashwagandha, I think, is great. If you're going to try that, maybe try it at night at first, because everybody reacts differently to medicine, and it might make you a little too calm or too sleepy. And so I would just suggest any of the melatonin, all these things you want to try. You want to try that when you're in the comfort of your own home, and you're able to. You don't have to worry about going to work or something like that. On Instagram, we've got a comment. Tamara Logan says, "I love red wine." Well, there we go. We appreciate you all. Say hello to our Instagram family. We're doing this on Instagram now, and I think this is our third episode doing that. And so I see we've got several people on Instagram. And then one day we'll figure out how to do this thing together. Let's see. Okay. But yeah, ashwagandha, I think, is amazing. Said I was able to sleep better after taking that. Okay. Yeah, I think it's wonderful, and say some people even combine it with maybe a 3 milligram melatonin. Ashwagandha, the popular form of that is in like a chew, like something that you chew, almost like a starburst, if you will. I'm guessing, I assume that it's available in other formats. Maybe it's available in a pill. I don't know, but the one I tried was like in a chewable format. So let's take. Let's see. We're at 8:00. Let's go to 8:05. I think we started. I think we started at 7:06. So let's do five more minutes so we can get a couple more questions. We always get some great questions, especially halfway through it to the end of it. Next segment, we need to dig deeper into the benefits of red wine. There you go. I got you. Okay. We're on the red wine kick. I got a bandwagon here tonight. That's no problem. That's what we say. Hey, that's what we're here for. No question is a bad one. Every question is fair game and good. And so, we appreciate everyone. And let me go and see. We have any questions over here from our Instagram family. We've got several people who have joined us on here. Let's see here. Now we'll look into that commenting thing that y'all talked about. I don't know why that. Okay, I don't know why that was an issue, because we never want to block anybody's comments or anything like that. Women want to know about it. Okay. Yeah, we've got a lot of. Let's see here. Let's see if we got any more. Let's see. Okay. Um, let's take the next two comments or questions. Let's take the next two comments or questions. That was a great question about ashwagandha. We've had some fantastic ones. We talked about a little recap. We talked about the difference between anxiety and a true heart attack. What are the symptoms and signs of strokes, and uh, what is early detection? Going to the primary care doctor or a nurse practitioner or a physician assistant. Talking about the benefits of red wine. We talked about people who want to try to be put on medicine instead of trying alternative methods first. And what are those alternative methods? Like I said, naturopathic and holistic medicine, definitely believe in that. A lot of physicians, for some reason, I guess because it's not, federally approved or things like that, or not going through the FDA. A lot of physicians don't, believe in alternative things like acupuncture and chiropractic medicine and naturopath, holistic medicine, herbal, all those kind of things. I believe in all that. Look, any way that we can get you to get off of some of this medicine, because some of this stuff, let's face it, is no good. And the formularies and things have changed over the years. And so that's no good for people. Not for our people, not for any people. And so if people are on blood pressure medicine and insulin and metformin for diabetes, Januvia, and all these kind of things. And then we can even delve into the Ozempics and all that stuff, because again, we don't have any ties to any company. There's nothing that's off limits. We're here for you to be able to talk about all your concerns, comments, questions. And that's why please make sure that you bring someone with you next Tuesday. Bring a friend, bring somebody with you. We hope that this has been an episode that has truly blessed you. This is certainly a part of our medical ministry. So again, we've got time for two quick questions. If y'all are going to send us some, we would love to hear from you. Let's see. Instagram, we got a couple more people. I see that they've joined, but I don't see any more questions on that side. So let me go back to the Facebook side. Like I said, we've got time. 1 or 2 more questions. I'll go ahead and do my ending there. And while you guys get into how important is it for men to practice self-care? Self-care is, wow. We talked about that a little bit. If y'all want to check out episode 35, where we had a couple of gentlemen on there, friends of mine, and we talked about things that are so important, men's health, for mental well-being, just self-care, and that is so important. It's crucial, critical. Self-care, just whether it's with daily prayers, whether it's having, your own life coach, your own mental health expert, it could be a psychologist, psychiatrist, or therapist, getting a manicure and a pedicure, massage, all those things are self-care, making sure, because a lot of times, I guess in us, hurt people. And a lot of times there are things that we haven't dealt with. And again, I'm personally, not immune to that either. And some things that we do and decisions we make that we regret, and some that you may regret for the rest of your life. And you don't want to be that person, it's not a good feeling. And so self-care, making sure that you, truly hone in on that, truly make sure, whatever your faith is, if you're a person of faith, making sure to, minister to yourself that way, listening to the voice of God or whatever it is that you believe in, or if you don't believe in God, just something positive in your life. Self-care is so important to men because that's something that we shy away from. And we feel like some men feel like it makes them more weak, that, we're talking about self-care. That's for women. Women go around pampering themselves and doing all this kind of foolishness. But now that's the sign of a strong man who knows that he does need help. He knows that he needs to practice self-care, so that's a great question. All right. Well, it looks like it's 8:06. I think that'll do it for us, folks. Listen, really appreciate you guys tuning in I know that, hey, you were stuck with me the whole night, but I still appreciate you. Hopefully, we didn't do too bad, and we answered every single one of your questions. I hope if you all have follow up questions, don't hesitate to go to our page on YouTube, which is Dr. BTV. The word Dr. DOCTOR, the letter BTV. Come on there and comment. Likes, questions, comments, concerns. Make sure to click subscribe. It's very important. Or our new page on Facebook, Michael Bookhart, MD, MBA, on Facebook, or my personal pages on Facebook and Instagram alike. So we hope to see you next week, Tuesday. We've got some amazing people. I've got another plastic surgeon lined up, African-American plastic surgeon. He's a young guy here. I think he's still in his 30s. So amazing guys over there working at the university. It's got a position, I think, at the department. His father's a good friend of mine as well. Here, he was a talented nephrologist. I think Dr. Davis retired from the hospital care, but one of the first people I met when I came to Mississippi. So we're going to have his son, we're going to have him on there, who's a plastic surgeon. We've got some other people coming up. We've got some trailblazer leaders in medicine. We've got another celebrity guest coming up, and we've got a couple of doctors coming up, some big leaders here in Mississippi, so in the Mississippi State Medical Association. And so make sure to stay tuned. So again, hope everyone will be blessed. Thank you for joining watching another episode of Telehealth Tuesday. We're here each and every Tuesday, 7 p.m. to 8 p.m. Central Standard Time. God willing, this is the place there's no subject off limits. We're here for you. And so, as always, please remember, true wealth begins with good health. We'll see you next week. Thanks, everybody.